Have you heard about the option for painless labor and delivery? If you have, then you might be wondering, how does it work? You have to be completely still during contractions. In this video, we're going to explain everything you need to know about what we call the miracle in a bottle, epidural anesthesia. First, let's break down the word epidural. Epi means above or upon, and dura refers to the tough membrane that surrounds the spinal cord. Put together, epidural describes a space just outside the dura. And when we inject the medicine into that space, it numbs the nerves that carry pain signals to the brain. So how does it work? When you have an epidural, a certified nurse anesthetist, or an anesthesiologist will first clean the area around your lower back and then insert a thin needle into the epidural space. Once the needle is in place, you'll receive medication through the needle. That medication is an anesthetic that blocks pain signals. After the medication is injected, the needle is removed and the anesthetic takes effect. Why choose epidural anesthesia? It's one of the most common ways to manage pain during childbirth because it relieves pain without putting you to sleep. You get to be awake for the birth of your baby and be actively involved in the process. What does it feel like? Many women describe the sensation of having an epidural as a warm, tingling feeling that spreads from your lower back down to your feet. Some women say that it feels like a really bad toothache that goes away quickly. Each person is different, and some people feel a little bit of pressure when the needle is inserted. However, most people do not feel pain when the epidural is administered correctly. Your care team will also use ultrasound guidance to help with the placement of the needle. Ultrasound guidance helps us find the right space on the first try and avoid any inadvertent needle sticks to other structures like the spinal cord or blood vessels. We always aim to make your experience as comfortable as possible. What happens after the epidural? After your epidural is placed, you may notice that you can't move your legs at first. This is normal, and it will go away after a few hours. You may also feel itchy because of the medication. If you do, just let your care team know, and they will give you a medication to help with the itchiness. What if the epidural doesn't take the pain away completely? While the epidural is working for most women, some may still feel pressure or feel mild pain during contractions. If this happens, don't panic. Just let your care team know, and they will give you more medication to help with the pain. Are there any downsides? There are very few downsides to getting an epidural, but like anything, there are risks and benefits to consider. Possible side effects include headache, backache, itching, and sometimes numbness or tingling in your legs or feet. Some women also experience a slight increase in blood pressure after receiving an epidural. Overall, though, the benefits of epidural anesthesia far outweigh the risks. What if I change my mind? If you decide that you want to have an epidural, but then you change your mind later, that's okay. You can always take it out. The catheter is attached to a special balloon that can be inflated to close off the space where the epidural was injected. Once the balloon is inflated, the catheter is removed and that's it. The epidural is finished. Can I walk with an epidural? Yes, absolutely. Many women walk with their epidural. Some even prefer to walk and use a wheelchair during labor. You can do whatever you feel comfortable with. Is it safe for my baby? Yes, your baby will be perfectly safe. We only use the safest medications for our patients. The goal of an epidural is to take the edge off the pain so that you can have a positive birth experience. We hope this video answered some of your questions about epidural anesthesia. If you have any concerns or questions, please talk to your doctor or your midwife. They're there to help you have the safest, most comfortable birth possible. Don't forget to subscribe for more great videos. Thank you for watching.